As an oral maxillofacial surgeon, one of the most common things we do are evaluate patients for the removal of wisdom teeth. The reason they're called wisdom teeth is because historically they start to come into someone's mouth around the age of 17, 18 to 23, and that's been known as the age of wisdom. Not sure whether that's true or not these days, but certainly that's the history of why they're called wisdom teeth. And wisdom teeth are really evaluated on a case-by-case basis. So it really starts with either the patient complaining of pain in the area of their lower upper jaw in the back and seeing their dentist who recommends to see an oral maxillofacial surgeon, or their dentist does an examination and sees that the patient has wisdom teeth, and then they are referred to an oral maxillofacial surgeon like myself for an evaluation. My feeling has always been that just because a patient walks in with a referral from a dentist saying evaluate these wisdom teeth, and just because I'm an oral maxillofacial surgeon doesn't mean that I have to extract someone's wisdom teeth. Every procedure, I feel like every time I touch a patient there are risks, and every surgery has risks to it. And it's really important to have an evaluation of whether or not the risks of the procedure are worth the benefits of the procedure. There are patients that I see almost on an everyday basis that have wisdom teeth but really have no reason to have them removed. And those are patients that I don't take wisdom teeth out on. I turn away patients that don't need surgery, and I tell them that you really have no indication to have the procedure done. So it's really important to see an oral maxillofacial surgeon who factors in the risks and benefits of the procedure, not just because a surgeon can do it, but does the patient really need to have it done. Now let's talk about some of the reasons why someone might need their wisdom teeth removed. Sometimes, because the wisdom teeth are the last teeth to come into the mouth, there isn't enough room in their jaw. And so the wisdom teeth might become what's called impacted. Impacted is just a word that means not erupted or not in their mouth like regular teeth. And because they're impacted, they can come in at certain angles, sideways or vertical or halfway sideways, which can push against other teeth. One of the reasons that oftentimes dentists refer patients for wisdom tooth evaluation is that patients have had braces and their teeth were nice and straight, and then all of a sudden their teeth are starting to shift. And it may be because the wisdom teeth are coming in a way that's pushing other teeth. So that might be a reason to have them removed. My consultation starts with a panoramic x-ray, and that's a special type of x-ray that goes around your head. It takes about 15 seconds. There's nothing that's put into the mouth. It's all external. And that type of x-ray shows us the patient's jaw, the entire lower jaw and the upper jaw, and including some very important structures such as nerves, sinus cavities, and the wisdom teeth, of course. And so from that x-ray I can tell what the position of the wisdom tooth is, how close is it to some nerves which give feeling to the lower jaw, the teeth, the lips, and the tongue, and are there any potential cysts or tumors or growths that can happen around wisdom teeth. Another indication to have a wisdom tooth removed is a cyst or a tumor that can develop around the wisdom tooth as it's growing. If the patient has wisdom teeth but they're not affecting any other teeth in their mouth, and they have no swelling or infection or pain, and there's no cysts or tumors, in my opinion, there's no indication to remove a wisdom tooth because the risk of the procedure outweighs the benefits. But certainly it's evaluated on a case-by-case basis based on the patient's own symptoms and anything that we discovered during the examination.